Welcome back to our allergy series. Today I'll be sharing 5 of the most effective strategies to reduce allergy symptoms and discuss briefly why some people get allergies while others don't. Hi, I'm Dr. Ashaye. I'm a board-certified family and lifestyle medicine doctor and owner of InTouch Primary Care in Sugar Land, Texas. And you're listening to Connecting the Dots with Dr. Ashaye. So if you or someone you know is tired of the hassle of traditional healthcare, or if you desire care that truly is personalized, I encourage you to check out our membership program at InTouch Primary Care, especially if you live in the Texas area. We're here to make healthcare convenient, accessible, and stress-free. Okay, so we're going to be talking, like I said, about the most helpful things you can do to reduce allergy symptoms. The first one I want to share is some people may not know that pollen counts are actually shared and monitored daily. And there are websites and apps like there's a website, pollen.com, that can alert you when the levels are high. And this can be helpful for those that have environmental allergies. And most of the time, people are allergic to pollen. And when their counts are high, that makes symptoms worse. So knowing when the pollen counts are high can be pretty helpful so that you can stay indoors if possible, or really limit your time outdoors in those scenarios so that you're less likely to be symptomatic during that time. The next thing that can be helpful, and many have found helpful, is using HEPA filters. So using HEPA, HEPA air filters and purifiers can be quite helpful in lowering exposure, and that's because it reduces indoor allergens. Studies have shown that HEPA filters reduce indoor allergens by at least 50 to 70%. So using HEPA filters, they can be put in your vents, or some people will get vacuums or get vacuums that have HEPA filters in them, and there are many these days. And that way, using that at least weekly to reduce indoor allergens can be quite helpful as well. The next tip I would recommend, and this I've actually noticed has truly, really helped many patients, and that's doing nasal saline rinses. And nasal saline rinses work well because they specifically clear out the allergens, like directly clear out the allergens from the nasal passages. And research supports saline irrigation for better breathing and fewer symptoms. And I've noticed this works very well for patients that can tolerate it. Just daily or 2-3 times a day, cleaning out their nasal passages has been really helpful to help them breathe better and have them have less symptoms. The other one, which kind of goes along with, cleaning out things, is taking a shower and changing clothes after being outside. The culprit here a lot of times is the hair. And I know that's tough for a lot of people, especially people that have curly hair, to wash their hair as often, but pollen does stick to hair. And covering your hair, if possible, can be helpful if you're going to be, when you know that pollen counts are going to be high, if you're not able to wash your hair as often. But just being aware that pollen does stick to hair, to skin, to clothing, to pets. And when you've been outside and then you come back in, you could be carrying the allergen in with you. So taking a shower, changing your clothes, washing your clothes right away with hot water, and then washing your hair if you're able to, can be quite helpful in lowering your allergy exposure. The last thing I want to share is also reducing indoor allergens, is especially for those that have dust mites allergies. People that have dust mite allergies will tend to notice they have more symptoms when they're indoors, number one. And then also they would notice that, especially when they turn on and off their ventilation system. So when they turn on the heat, maybe it's been cold, it's been warm for a while, and then it gets cold like it did a couple of days here in the Houston area. And then you turn on your heat, your allergies may worsen at that time because then, the dust mite exposure at that point. But things to help with that: washing your bed in hot water every week can be helpful, and then using a pillow cover, a mattress cover, can be quite helpful as well to lower your exposure to dust mites, and also keep the pets out of the bedroom as much as possible. So, as I mentioned earlier, some people might be wondering, okay, how come I have allergies, right? Well, one reason is if you have one parent that has allergies, there's actually a 30 to 50% chance that you will too. And if both parents have allergies, then you have a 60 to 80% that you would have allergies too. So basically, allergies can run in the family. So a family history of allergies does increase your risk of having allergies, in other words. And I see this all the time. Usually, I'm treating both parent and child in terms of allergy symptoms. Okay, so if you want to take control of your allergies, I wanted you to be aware we do offer allergy testing and treatment options that are very effective. So if you're interested in learning about what options we have for allergy testing and treatment, you can go ahead and schedule your consultation with us by clicking on the link in the chat. I hope that helps. Have a good day.